Welcome to The Explainer. So today we're diving into something pretty revolutionary, a way to take medicine that means you don't have to swallow a single pill. We're talking about this super clever method that uses a hiding spot right inside your own mouth to make drugs work way better and faster too. So let's kick things off with a question. Have you ever wondered what really happens after you swallow a pill? You'd think all that medicine goes right to work, right? Well, not exactly. The truth is, a huge chunk of it gets destroyed before it can even do its job. So why is that?
Okay, to really get it, you've got to picture the journey that pill takes. It's not a smooth ride, it's more like an obstacle course. And the biggest, baddest obstacle of them all has a name: the first pass effect. All right, so check this out. On the left, you've got the usual route for a pill. It's a total gauntlet. First, it has to survive your stomach acid, then it hits the liver, which is kind of like this biological customs agent that just destroys a huge chunk of the drug. That's the first pass effect we were just talking about. But now, look at the right, the Buccal route. It's a total shortcut, a VIP pass. The medicine soaks right through your cheek, straight into your bloodstream. It gets to skip all those dangerous barriers. So scientists knew they had to find a way around this problem, and they started looking for an alternative route. And you know where they found it? Somewhere so obvious. It was hiding in plain sight the entire time, the inside of your cheek. So why the cheek? Well, the lining of your cheek, the fancy term is buccal mucosa, is basically the perfect spot. First, it's packed with blood vessels, which means super fast absorption. Second, it completely dodges that whole liver problem, no first pass effect. And third, the tissue is soft, It doesn't have that tough protective layer like our skin does, so it's way easier for medicine to get through. And when I say it's easy to get through, I mean it. The tissue there is unbelievably thin. We're talking 500 to 800 micrometers. To put that in perspective, that's thinner than your credit card. It's a huge part of why this whole thing works so well. And this chart? It shows perfectly why the cheek is the just right spot. See, under your tongue, things get absorbed super fast. The roof of your mouth, way too slow. But the cheek, it's right there in the middle. It's the perfect sweet spot for a steady, controlled release of medicine. Not too fast, not too slow. Okay, but think about it. How in the world do you get a little patch to stick to the inside of your mouth? I mean, it's wet, it's slippery, you're talking, you're eating. Well, the answer is found in this really cool field of science. It's all about something called mucoadhesion. That's basically the science of getting things to stick to that slimy mucus layer inside our mouths. And honestly, the molecular Velcro idea is spot on. It's like creating this tiny, super strong, but totally temporary bond. So how does this Velcro work? It's a really neat two-step dance. First, the patch soaks up a bit of saliva, and that makes it swell up and get all of its sticky bits ready. Then, and this is the cool part, its long polymer chains start to tangle up with the chains in your mucus. That spaghetti analogy is perfect, right? Just imagine two piles of spaghetti getting all mixed up until they're totally interlocked. That's what creates the bond. Now, obviously, you can't just use any old material. Scientists are incredibly specific about this. They engineer these polymers to have the perfect traits for maximum stickiness. They need to be big, they need to be flexible so they can tangle up easily, they need the right electrical charge. All these little details have to be perfect for it to work. Of course, it's not all smooth sailing. I mean, the mouth is a pretty complicated place, so researchers have had to get really, really creative to overcome some of the big challenges here. So, challenge number 1. Even though the cheek lining is thin, the cells themselves are packed together super tightly, almost like a brick wall. This creates a really effective natural barrier. So the trick isn't just getting to the wall, it's getting through it. And the solution is just brilliant. They use these things called permeation enhancers. Think of them like chemical keys. They're mixed into the drug, and their whole job is to act like a temporary gate opener. They safely loosen the mortar between those cellular bricks just for a moment, letting the drug molecules sneak right on through. And this quote really drives the point home. It shows you just how critical this part is. Finding the right, safe gate openers isn't just a minor detail. It's the key. It's what will unlock the entire future of this technology. All right, challenge number 2 is, well, it's your mouth. You've got saliva constantly trying to wash everything away. And let's be real, if you're going to stick something in your mouth for a while, it can't taste awful or feel like you've got a rock in your cheek. That mouthfeel is a huge deal for people to actually use it.
And to fix that, the innovations are just awesome. They've come up with all sorts of clever designs. They can hide the bad taste inside special molecules, create these paper-thin, flexible films you'd barely even notice are there, and even build these little one-way tablets that make sure the drug only goes towards your cheek, not into the rest of your mouth. So smart. Okay, so we've got all this amazing science, all these brilliant solutions, but what's the big picture? What does this all add up to? Where is this technology actually going? This is where it gets really, really cool. This technology isn't just a small improvement. It could totally revolutionize how we take all kinds of medicine. We're not just talking about simple stuff. We're talking about powerful pain meds, antibiotics, and get this, even things like insulin. These are complex molecules that normally get chewed up by the stomach, which is why they have to be injected. This could change all of that. So just think about that for a second. An approach that makes medicine more effective, could get rid of painful needles for millions of people, and gives doctors a brand new way to deliver drugs over time. It's incredible. And it really makes you wonder, right? With all this potential, what other huge breakthroughs are hiding out there, in places we see every day but have never really looked at?